So let's talk about the first case. Let's see um, what this ECG shows. Those who have attended, I'm sure all of you have attended and participated. So anyone who knows what's going on this slide, what's wrong with this ECG? I want a quick answer because we are going live, so I can share my thoughts quickly.
ST elevation.
ST elevation in second, third AVF.
Good. So all of you picked up correct. So this is like, normal sinus rhythm, PQRS is fine, QRS complex is normal, but you can see that there is a ST segment elevation in inferior lead.
ST elevation.
You can see in V1, V2. Now, I'm glad that Saqib has taught you all that. Now, I'm going to talk about emergency medicine, how this ECG has got a different management and what we will do differently. So let's talk about if this patient, what are you going to give this patient? How are you going to treat this patient? This patient comes to you with the chest pain and you did the ECG, drops being sent. So what would be your treatment plan? How are you going to, what medications you will give? I know you are going to plan angioplasty for him, but before that, are you going to give him any medication?
ACS protocol.
What is that? What is ACS protocol? He's got a chest pain. What medications you will give?
Aspart 300 mg.
Aspirin, yeah. What else?
Loclate.
Painkillers, oxygen,
Painkillers, and anything else?
Low molecular weight
heparin.
Heparin,
enoxaparin, and thrombolytics probably.
and for chest pain?
Morphine.
morphine.
GTN or NSAID nitrates. So all of you agree with this plan, isn't it? All of you agree with the treatment? So now, all of you just say, how many of you will give GTN to this patient to relieve his pain, or NSAID or sublingual GTN? How many of you will give it to him? Say yes.
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 Yes, sir.
Yes, sir.
Yes. Yes.
All right. So whoever will give GTN to this patient, basically, he's going to kill this patient. All right. Now, why? Always remember, whenever you have inferior lead MI, you have to be very, very careful. Don't just jump to the conclusion. Inferior wall MIs can be aortic dissections because aortic root dissect at that level. So be very, very careful before you jump for ACS protocol. Now, if you look at the pattern, V1 and V2, there is an ST elevation. So what do you see here? Do you see anything different? This is still the case one. So which wall of the heart is affected? Let's talk about the first ECG. Which wall of the heart is affected? Which is this wall?
Interior.
Inferior. Yeah?
Interior.
And it's got inferior as well. So inferior, anterior. Now, there's one more important thing that I think probably all of you need to remember this, which is very important. Look at lead 2 and look at lead 3. Which ST segment elevation is more? Is it lead 2 or lead 3?
Lead 3.
Which ST is high?
Lead 3.
3 ST is high, isn't it? So whenever you see a patient who has inferior wall ST elevation, lead 3 ST is higher than lead 2, start thinking of right
Inferior wall.
ventricular infarction. Start thinking of right ventricular infarction. Now, if you think right ventricular infarction, how are you going to confirm that? You are going to confirm by doing another ECG. Tell the nurse to apply the lead V4 on the right side of the chest. Now, I think probably you will be the only A&E doctor or medical doctor who will make this unusual request, and the nurses will say, "ये doctor पता नहीं कैसा है, ये अजीब request कर रहा है." And when you place this on the right side of the chest, you will see that there is a patient has got ST elevation in lead 4 as well. Now, what I requested you to pick this V4 from here to place it here. Is it difficult? No, it's not difficult. Just high degree of suspicion. जैसे ही आपने suspect किया कि यार कहीं इसको right ventricular infarct तो नहीं है, क्योंकि lead 3 में ST segment elevation ज़्यादा है compared to lead 2. You put this lead, pick up from here and apply here. Up now, this is exactly looking at the right ventricle. जैसे डॉक्टर साकिब ने आपको सुबह बताया ना कि it's like a video camera which is looking at the right ventricle. And then you will see this ECG which confirms that patient has got the right ventricular infarct. Now, अगर आप ECG देखें तो rhythm sinus था, normal axis थी, maybe borderline AV block था, signs of inferior STMI थे, lead 2-3 AVF में, और इसके reciprocal changes थे, या सब यही था ना. लेकिन राइट वेंट्रिकुलर इन्फार्क्ट जो था वो आप सबने मिस किया. कैसे मिस किया कि अगर आपने ये पिक कर लिया होता कि ST elevation in lead 3 is more than 2 and ST elevation in lead V1 and V2. This is important. Now, if you look at his V4R, which confirms the right ventricular infarction, you see that? Are you with me?
Yes,
Yes.
sir.
आवाज आ रही है?
Yes, sir. Yes.
समझ आई है आपको? और अब आप देखिए कि जब ये राइट वेंट्रिकुलर इन्फार्क्ट है, पेशेंट राइट वेंट्रिकुलर इन्फार्क्ट के जो होते हैं वो हाइपोटेंसिव होते हैं या हाइपरटेंसिव होते हैं? हाइपोटेंसिव होते हैं ना, क्योंकि राइट वेंट्रिकल इज नाउ नॉट फिलिंग एंड पेशेंट ब्लड प्रेशर विल बी लो. आप सब ये समझेंगे कि पेशेंट का जो ब्लड प्रेशर लो है, पेशेंट इज इन कार्डियोजेनिक शॉक, और आप उसको फिर फ्लूइड देंगे या नहीं देंगे? How many of you will give fluid to a patient with acute MI? Yes or no? Just say yes or no. Fluid to patient with acute MI?
No.
No, sir.
No. Good.
No.
That was expected. तो जो भी fluid नहीं देगा, basically, actually वो patient को मार देगा. This patient will be dead. Because right ventricular infarct के जो patients हैं, they respond very well to the fluid boluses. Frank Starling forces काम करेंगी, right ventricle wall stretched होंगी, fluid right ventricle में जाएगा, and then it goes to it takes the blood further, और आपका blood pressure जो है वो respond करेगा. So most important point here to know is, don't just look at STE in lead 3, 2, check lead V1, lead 2, request for right side V4 lead, confirm that this is the right ventricular wall infarct, and then you can give judicious fluid to them, and give the fluids, and do not give nitrate to them, because these patients can have an exaggerated hypotensive response and patient can go into cardiac arrest. Very, very common scenario. All MRCP, MRChem, whatever exam you will do, you will get this in your exam. So, you are lucky people, because to be honest, even after so many years of our graduation, we didn't know this fact. Now you guys know. So take home messages. If you look at this ECG, yeah, if you see